Welcome to Healthy Care. Today, we're diving into a topic that many new parents face: common baby feeding problems. From picky eaters to digestive issues, we'll explore the challenges and offer solutions to help your little one enjoy mealtime. Let's get started. 1. Baby avoids new foods. It's a well-known fact that children are naturally inclined to reject new foods. According to Elizabeth Ward, MS, RD, author of The Complete Idiot's Guide to Feeding Your Baby and Toddler, this behavior is normal. To help your baby accept new flavors, start with small portions and present them alongside familiar favorites. For instance, if your baby loves pureed carrots, try introducing pureed sweet potatoes for a gentle transition. Remember, patience is key. 2. Messy eaters. Feeding the floor. Around 9 months of age, many babies begin to assert their independence during mealtimes. If you find cereal on the floor and peas in your baby's hair, don't worry. This messiness is a sign of growth and learning. While it may be tough to watch the chaos unfold, allow your baby to explore and learn about food. It's all part of their development. 3. Spitting up, vomiting, and baby reflux. Spitting up is quite common among newborns as their digestive systems are still maturing. Reflux, where food travels back up into the esophagus, is also a frequent issue. To alleviate this, try feeding your baby smaller portions and keeping them upright for a bit after meals. Most babies outgrow reflux by 12 to 14 months, so rest assured, it often resolves itself without treatment. 4. Refusing food baby doesn't want. Have you ever offered food only to have your baby turn their head away or clamp their mouth shut? This can happen for a variety of reasons. Your baby might be tired, sick, distracted, or simply full. Forcing them to eat can create negative associations with food. Instead, if you're concerned about your baby's eating habits, don't hesitate to consult their doctor. 5. What's up with picky eaters? Picky eating can be a frustrating phase for many parents. While it may last for weeks or even months, it's often temporary. Babies may prefer familiar foods when they're feeling unwell, such as during teething. Ensure that you're not offering junk food as a fallback. Instead, provide healthy options. A hungry baby is more likely to explore and accept new tastes over time. 6. Food allergies and intolerances. Food allergies affect up to 8% of children, with symptoms like rashes, diarrhea, or vomiting. Common allergens include milk, nuts, eggs, and wheat. On the other hand, food intolerances, which can cause bloating and gas, are even more prevalent. If you suspect your baby has a food allergy, work closely with their pediatrician to identify safe foods. 7. Colic and baby's appetite. Colic can affect up to 40% of babies, causing long crying spells. While colic doesn't typically interfere with feeding, a colicky baby may need time to calm down before they eat. Keep an eye out for signs of more serious issues, such as vomiting or bloody stools, and always consult your pediatrician if you have concerns. 8. Diarrhea and constipation. Diarrhea can lead to severe dehydration in infants. Signs to watch for include dry mouth, reduced urination, and lethargy. Conversely, constipation in babies is less common but can be hard to identify. If your baby exhibits hard stools or discomfort, consult their doctor before trying any home remedies. 9. Jarred baby food and stomach distress. If your baby is experiencing digestive issues, consider how you're serving jarred baby food. If you feed directly from the jar, leftover food can harbor bacteria from your baby's mouth. Always store uneaten portions separately to prevent tummy troubles. 10. Older babies and junk food. As your baby grows, it can be tempting to share your meals. However, introducing sweet, salty, or fatty foods too soon can set up unhealthy habits. Focus on offering nutritious foods to establish a healthy relationship with food early on. 11. Foods to avoid giving baby. Certain foods can pose serious risks to babies. Honey, for instance, can cause infant botulism, which is potentially fatal. Additionally, avoid foods that present choking hazards, like popcorn, raw vegetables, and whole grapes. Always prioritize safety when introducing new foods. 12. When to get a pediatrician's advice. If you're worried about your baby's feeding problems, don't hesitate to consult their doctor. Contact your pediatrician if your baby is losing weight, gagging or vomiting with specific foods, or showing signs of dehydration or reflux. Remember, no question is too small when it comes to your child's health. Thank you for watching our video on common baby feeding problems. We hope these tips help you navigate mealtime challenges with ease. Don't forget to subscribe for more parenting tips and health advice. Happy feeding!